Sleep apnea is a sleeping disorder that comes with a variety of symptoms. But the good news is that it can be tested for, diagnosed, and treated with CPAP therapy. But what is sleep apnea and what are its symptoms? Well, here's the RespShop lowdown. Sleep apnea comes in different types, but they all cause a closing of the airways during sleep. As your airway closes, your oxygen levels drop, and eventually your brain wakes you up to reopen your airway so you can breathe properly again. Now, usually this waking process happens too briefly to notice, but the problem simply repeats when you fall asleep again and your body misses out on the deepest, most restful phases of sleep. And to give you an idea of just how often your sleep can be interrupted this way, moderate apnea sufferers will be woken up between 120 and 239 times per night, often without even being aware of it. So no wonder you feel tired. So how do you know if you have sleep apnea? Well, here are my top 5 telltale signs. Number 1, as you may have guessed, is regular daytime tiredness, even after a full night of sleep. The medical term for this is hypersomnia. Now, there can be other reasons for daytime tiredness other than sleep apnea, things like high stress or a change in medication, but if excessive tiredness is a regular feature of your life and it doesn't seem to be coinciding with any of these other risk factors, then sleep apnea may well be the reason. Number 2 is loud snoring. Now, as your airway closes, the rushing air makes the relaxed tissue vibrate, which causes that wonderful snorting sound that everybody can hear and enjoy. Now, everybody snores a bit, but if you realize that your snoring is getting worse or extra loud, or if more likely your bed partner notices it, then that's another sign of sleep apnea. Number 3 is pauses in your breathing. As I said, your breathing pauses and the awakenings can often go unnoticed, but sometimes you do vaguely remember having a disturbed sleep. And sometimes your bed partner might notice you waking up regularly or that your breathing pattern is a bit chaotic. If so, that can mean sleep apnea. Number 4 is a little more dramatic, and that is gasping or choking. Now, if your breathing stops completely because of a closed airway, it can result in a more sharp awakening, followed by rapid gasps or choking. Now, this is something you're more likely to notice than the less intense kinds of waking. Number 5 is morning headaches. All those interruptions to your breathing reduces your oxygen intake, and this means less oxygen for your brain, which can lead to headaches in the morning. If these become regular and noticeable, it can suggest that sleep apnea is the underlying problem. So what do you do if you notice some or all of these symptoms I've just mentioned? Easy. You need to take a sleep study test. These tests can now be done at home and are both convenient and affordable. You can order a testing kit from our website and we will send one to you along with simple instructions for conducting the test yourself. The test requires you to strap something to your wrist, attach a sensor on your chest, and then sleep as normal while your phone collects and transmits data to our medical professionals and your physician via a dedicated app. And after that, you have a 15-minute consultation with one of our sleep physicians, and if you get a positive diagnosis, we can then arrange for a prescription to be drawn up for CPAP therapy, which is the most typical treatment prescribed for those that suffer with sleep apnea. CPAP therapy uses a machine to provide extra pressure to the air entering your airway via a mask, which keeps your airway open and your sleep uninterrupted. So if that sounds like something you'd want to look into further, then feel free to get in touch with us. And in the meantime, sleep tight.